A quick review: the pharmacology of autonomic drugs, sympathetic. So now we will starting with the beta receptors. So we have the beta 1, it's present in different area. So starting with the presence of beta 1 in the heart. The stimulation of the beta 1 in the heart is going to increase the cardiac output because it's going to increase the heart rate, increasing the conduction velocity, increasing the stroke volume, and also they are going to increase the rate of relaxation of the myocardium because they are going to increase the calcium ion transport inside the sarcoplasmic reticulum, and that will be aid in increasing the heart rate. The second, the beta 1 receptor will be present in the kidney, and we know that is going to increase the renin secretion. Also, it is present in the stomach, and that will be going to increase the hunger hormone that will be released from the stomach. Beside, as we already mentioned, that is going to increase the aqueous humor from the ciliary body epithelium, the aqueous humor secretion, and also will be increasing the lipolysis from the adipocytes. Dobutamine, it is a beta 1 agonist. This drug is supposed to be given by an IV infusion. It's going to increase the cardiac output. However, because it's not stimulating the beta 2 receptor in the smooth muscle in the vascular bed, so it's going to produce less reflex tachycardia comparing with the non-selective beta agonist. Its structure similar to dopamine, and it also is going to stimulate the alpha receptors. The main utilization for dobutamine is in the management of cardiogenic shock and also in the management of acute heart failure. The beta 2 receptor is present in different area. We're starting with their presence in the smooth muscle. So the stimulation of the beta 2 receptors will be produce relaxation in the smooth muscle in the bronchi and produce bronchodilation. In addition, I will add it here that they are going to inhibit the release of histamine from the mast cells. So we will use that in the management of asthma. Also, they are going to produce a smooth muscle relaxation in the GI tract, and that will be decreasing the motility. However, they are going to produce a contraction in the sphincters. Also, they are going to produce a relaxation in the smooth muscle, in the veins and in the arteries, specifically those the ones that will be going to the skeletal muscle, mainly for the arteries that will be going to the skeletal muscles. Besides, they are going to reduce or produce relaxation in the smooth muscle in the uterus. And now in the liver, the stimulation of beta 2 receptor in the liver is responsible about increasing the blood glucose through the glycogenolysis and the gluconeogenesis that will be happening in the liver. And also in the pancreatic beta cells, they are going to increase the secretion of insulin. Also, the beta 2 receptor, specifically the stimulation of the beta 2 receptor in the ciliary body epithelium by the circulating epinephrine is going to increase the aqueous humor secretion. Now, for some of the beta-2 agonists that we use it to produce a smooth muscle relaxation in the bronchi. So we have albuterol, the other name is salbutamol, and you can see almost all these medication, they ending with tirol. The name is ending with tirol, so it will be easy for you to remember. And also you can see that I label it for you, that for an example like indacaterol, those I label it with them with a black in the beginning. They are useful in the management of COPD, chronic obstructive pulmonary disease. We use it in this management. The other medications that we use it in asthma mainly, and we have also, I label it for you, we have a salmeterol and formoterol, these which containing the MMO, just like to consider as meter as a prolonged, they have a prolonged duration of action, almost more than 12 hours. So this medication in the management of asthma is going, because still going to stimulate the beta-2 receptor in the muscle spindle, so they might be producing a tremor, and also they might be leading to a tachycardia. Now, this medication in the management of asthma, we give it by inhalation. Another drug that it is a beta-2 agonist, terbutaline. This medication was used previously to relax the pregnant uterus, and it was used to suppress the premature labor. Now it's supposed not to be used, okay, because they figure out that it may increase the maternal morbidity and will not have any significant benefit on the perinatal infant mortality.